Hi guys.
Guys,
We are back from our spring break travel and we are refreshed and ready to go.
Disney cruise first,
And
maybe last.
no,
The kids would definitely do it again.
yes.
I'll probably opt for one with a casino.
There we go. Yep. And we're back from Florida. We had a great time, but we spent a lot of time in swimsuits, which got us thinking about
Even me.
laser hair removal.
Yes.
Yeah, unwanted
Yes.
hair.
Yes.
And it's something we get a lot of questions about. We haven't done a tea time on it, so we're like, this is a good time to do it.
Well, and usually once a year, because I'm the worst patient, is when I do my laser hair removal, and it's usually before a spring break trip.
He gets a little self-conscious.
And it's my back hair. Letting it all out there.
Yes.
But I just don't have time, so I'm not consistent with it. But that is the most important thing about laser hair removal, is to be consistent with it.
Yeah, and everybody has unwanted hair somewhere, right? And we are like, look at him, he's a little self-conscious of it. He doesn't want to talk about it.
It looks good right now.
So laser hair removal is definitely popular. You see lots of clinics out there, right, doing laser hair removal. We've had it for a long time. We upgraded our machine.
Mainly because I'm a big baby.
Yes.
Right?
Yeah.
So we have two different types of laser hair removal, actually three. But the one that I used in the past, probably like 5 years ago, it hurt. And
the old ones were painful.
Yes.
The old lasers were painful. I loved to do it on him because I loved to have him scream while doing it. But then he was like, no, nobody wants to do it. Nobody wants to get this procedure done.
That's because you brought an audience into the room to watch me like cry.
Yes.
So
we have video.
I wasn't good about it. So we got a newer machine probably about 2 years ago, and it's called the Motus AZ Plus. The biggest thing that I liked about that was that, one, it's a very versatile device, but then two, it's got painless hair removal, which it doesn't sound real, but it's real.
Yeah, we've both done it. So we've both done the old machine and our newer machine, and it truly is painless. And actually, I think that the newer machine is a little more effective as well, too. You can use it on all skin types, which is great. So anyone can get it done.
We want to let you guys know, though, like, because there's always a lot of myths about hair removal, and it's like that it's, first of all, no hair removal device is permanent unless it's electrolysis, okay? So what happens with hair removal devices and how this laser works, it is essentially, it's following the hair follicle down to the root, the bulb, and destroying it there. But in any given cycle of life, we are forming new hair follicles, but they just happen to get less and less and less. So what we call hair removal is actually permanent hair reduction. It's not permanent hair removal, because it's just, there's no technology from the laser standpoint that is getting rid of all your future hair, right? It's getting rid of hair that's in place right now.
And yeah, that's important to say. So like all of our hair is on a different cycle. If it wasn't, then we would have hair and then we would be bald, right? If our hair was on the same cycle, because there's a growing phase and then there's a phase where the hair falls out as well. And the laser is only targeting the actively growing hair, which is why you need multiple sessions to treat the full area.
Correct. So, and we usually space out depending on which area you're doing, the hair cycle grows in different lengths. So that's why we would say, hey, if you're getting your leg hair laser haired, it might be 6 to 8 weeks when you come back for your first treatment. If you're doing like more of your facial hair,
4
it's
weeks.
faster, right?
Yeah.
So it's 4 weeks. So the timeline of when you come in is important. Also, the prep on laser hair removal. People, like, we don't want you waxing, we don't want you shaving. We don't want you waxing, we don't want you plucking before you come in for hair removal. Shaving is fine, right? Like, actually, we want you to shave. We just want that hair to be right underneath the skin surface, so that when we do the laser's energy and heat it knows where to track and where to go. Right? It can follow the hair follicle.
Yeah, if you wax or tweeze, you're pulling that whole hair follicle out, and so then there's nothing for the laser to target, which is why you have to shave prior to the treatment. There's also factors that are involved in hair growth as well. So hormones are a big one. So a lot of times, like for me, I had my first laser hair removal before I had any of my pregnancies, and now after having 3 kids, I've gone through the cycles again, because hormones do change, and then they can cause you to sprout some new hairs or some new hair growth.
And a lot of areas, there's thicker hair in certain areas. Oftentimes, even with women, we come in and they're really like their chart, like even if it's their chin or they're above their lip hair. And based on hormones, it's also why we see like female acne tends to be more around the jawline, more in the lower part of the face. That hair is thicker, more stubborn. It's growing at a faster rate. There's new hair that's coming in. And so sometimes we're just like, hey, look, like it's gonna get better. It's just not gonna completely go away, right?
Yeah.
But if you're essentially it should be thinner and lighter each subsequent treatment. Right?
Yeah. And so laser hair removal, it is effective. It's great. Obviously, we've both done it. We both like it, but it is something that is a myth about it. So that's why we wanted to kind of touch on it, and that you're not going to be completely bald in that area for the rest of your life. You probably will get some hair growth over time.
And there's a variance, right? You might have a friend that is like, oh my God, it worked great. I don't have any hair. And you're like, oh, how come it did? Well, everybody's different, right? And hormones are different, and what we eat and what medications we're on can kind of all play a factor in why someone's hair might still come back at a different rate versus someone else's. Also, the color of the hair makes a big deal, right? Yeah. Like we really cannot treat gray or blonde hair.
And red hair is also pretty hard to treat as well, unless it's a darker red. But if it's that really light red, it's hard to treat.
And the concept behind that is that there's something called chromophore in the hair follicle, which is a pigment. So the laser has to be able to see that, right? And if it's white or if it's blonde, there's too little or no chromophore, and so the laser can't find it and track it down. So sometimes patients are like, yeah, everything's really good on my upper lip or my chin, but there's still these gray hairs that keep coming back. And we're honestly, if someone tells you they're going to treat it and it's going to go away forever, they're lying, right? Like you just can't do it. Otherwise, you have to get electrolysis. Right?
Yeah. And so, it is effective. It is painless, like we talked about. Yeah. We do them in series of 6, and they're spaced out depending on what part of the body. A lot of times people, after their 4th or 5th treatment, will kind of hold on to their last 1 or 2 because the hair growth isn't there. Yeah. And so maybe they'll come back at like 8 to 12 weeks when they start to see the hair.
We don't want to waste the treatment if you're not even seeing hair growth. So it's really, the client has to tell us, like, actually, I'm really good right now. It's actually hasn't come back. And then we're like, great, hold off on it for maybe a couple more weeks. And when you feel that maybe it's coming back, that's when you schedule for your next appointment. We are, and it's not that you do 6 and you're never seeing us again. Usually after that 6, if it's high, what do we say? Like 85, 95% of hair reduction. And then maybe once a year or twice a year you're coming in. Again, it varies on person, right? That's the biggest thing we want.
We have some patients that just like to come in once a season just to freshen up on it, but it definitely depends.
That's me.
Yeah, there you go. Absolutely. When it's summertime, that's when he's coming.
But that is the point. I mean, like, we're starting to see, even though we had some like winter weather yesterday, it is going to start getting nice, and now tank tops are going to be out. This is the time where people start to do their treatments so that they're ready for the summer. So we thought it was a good topic to kind of touch base on.
Yeah. And most popular areas, upper lip, chin, underarms, bikini, Brazilian. We do. We have done some full legs. We've done arms, back. Men is popular.
Also,
for the back.
We get a lot of police officers that come in to from a shaving standpoint, which kind of want like their neck done or their back of their head. So back of the neck. So if ladies out there, if you're annoyed of shaving your significant other's back hair, like my wife probably is, or the trimming the back, that's a great time. It's a great opportunity for them to come in and get it done. And we know men are typically babies. I'm a baby. It does not hurt. It's painless, right? So it is a painless treatment.
And also like razor burn. So a lot of our patients, they're not really that concerned about the hair, but when they shave, they get those bumps that are painful, right? And they can become like pustules, like little pimples in the area. So they want to get rid of the hair so that they don't have to shave. Shaving doesn't necessarily, bother them to do it every day, but they're getting the repercussions and they're getting rashes from it. And so they're doing it for that reason as well.
Yeah, I think it's it's why we've included in our membership, right? So our members can get a small area hair removal part of their monthly treatment. And normally, I think when patients do it the first time, they're like, oh my God, why have I been waxing? They're like, this is so much.
That would be me.
Because really, until you do it, because there's a lot of like fear, but like we've invested in one of the best lasers, which is it is painless, right? And so when you can treat hair without pain, and you don't have to bother taking that extra couple minutes to shave in the shower or go somewhere to get a wax, deal with irritation and things like that. It's a no-brainer to me.
Yeah, absolutely.
Sign me up for more.
All right, I will. If you guys have any questions, give us a call. Come on in for a consultation. We can talk to you more about it. But thanks, guys.
All right, cheers.